The preamble of the Universal Declaration of Ethical Principles for Psychologists highlights the fundamental importance of ethics in the practice of psychology and psychometrics. It emphasizes the broader societal context in which psychologists and psychometricians operate and their commitment to ethical principles that guide their professional and scientific work. In the context of psychology of exceptional children, here are some practical examples and context. The psychology of exceptional children involves providing psychological services and support to children with various exceptionalities, such as learning disabilities, autism, or intellectual disabilities. These services aim to enhance the well-being and development of these children within the larger societal context. Ethical principles are crucial in this field to ensure that the rights and welfare of exceptional children and their families are protected and upheld. Consider a psychologist specializing in the assessment of children with learning disabilities. In this context, the psychologist must adhere to ethical principles such as confidentiality and informed consent. When conducting assessments, the psychologist must ensure that the child's personal information and assessment results are kept confidential. The psychologist also needs to obtain informed consent from the child's parents or guardians before conducting assessments, respecting the rights of the child and their family. In the case of an educational institution that provides support to children with autism, spectrum disorders, ethical principles related to inclusivity and non-discrimination come into play. Psychologists and educators must ensure that children with autism are treated with respect and provided with equal and opportunities for education and development. This involves creating inclusive learning environments, adapting teaching strategies, and promoting acceptance and understanding among peers. In the context of providing counseling services to families of children with intellectual disabilities, ethical principles related to beneficence and cultural competence are essential. Psychologists need to ensure that their interventions are aimed at improving the well-being of both the child and their family. Additionally, they must be culturally sensitive and consider the unique cultural beliefs and values of the families they serve. The preamble highlights that psychologists and psychometricians are committed to placing the welfare of society and its members above the self-interest of discipline. In the psychology of exceptional children, this ethical commitment means prioritizing the well-being and development of children with exceptionalities and, of course, their families. It also emphasizes the importance of promoting inclusivity, respecting diversity, and adhering to cultural competence principles in order to enhance the quality of life for all individuals, including those exceptional needs. So overall, the preamble of the Universal Declaration underscores the universal relevance of ethical principles in the practice of psychology and psychometrics, guiding professionals to uphold the highest ethical ideals in their work with exceptional children and their families in this particular context. Let's talk about the principle. Principle number one, respect for dignity of persons and peoples. In the context of exceptional children, principle one, which emphasizing respect for the dignity of persons and peoples, holds profound significance. This principle underlines the importance of recognizing the inherent worth of all individuals regardless of their social status, abilities, or other characteristics. It also acknowledges the value of different cultures and communities and their impact on the well-being of individuals. For example, a psychologist working with exceptional children, such as those with autism spectrum disorders, demonstrates respect for their unique worth by recognizing and valuing each child's individual strengths and challenges. The psychologist tailors interventions and support to meet the specific needs and abilities of each child, promoting their dignity and self-esteem. On respect for diversity among exceptional children, in a school setting, for example, there may be exceptional children with a wide range of needs and abilities, including those with learning disabilities, giftedness, and behavioral challenges. Practitioners in this context respect diversity by adopting inclusive practices that accommodate the individual needs of each exceptional child, ensuring they have access to appropriate education and support. On respect for cultural customs and beliefs, when working with families or exceptional children from diverse cultural backgrounds, psychologists and educators respect cultural customs and beliefs. For example, they consider the cultural context when designing intervention plans, ensuring that they align with values and practices of the family while promoting the well-being of the child. On free and informed consent for intervention, before implementing any psychological intervention or assessment with exceptional child, practitioners seek free and informed consent from child's parents or guardians. This process respects the autonomy of the family while ensuring that they fully understand the nature and purpose of the intervention. Psychologists and special education professionals also protect privacy and confidentiality. They safeguard sensitive information such as assessment results or treatment plans, ensuring that it is shared only with authorized individuals to maintain dignity and privacy of the child and their family. For example, in an inclusive classroom where exceptional children learn alongside their typical developing peers, educators ensure fairness and justice by providing appropriate accommodations and support. They aim to create an equitable learning environment that promotes the dignity and educational rights of all students. On respect for the environment, for example, practitioners in the psychology of exceptional children recognize the importance of safe and supportive environment. They advocate for inclusive and accessible spaces that accommodate the diverse needs of exceptional children, ensuring their physical and emotional well-being. So all in all, principle one, which emphasizing the respect for the dignity of persons and people, serves as a guide ethical foundations in the it also underscores the value of individual differences, cultural diversity, and the rights of exceptional children and their families. Practitioners in this field uphold these principles to promote the well-being and dignity of exceptional children as they strive to reach their full potential. Next is what we call the principle number two on competent caring for well-being of persons and peoples. In the context of psychology of exceptional children, principle two underscores the importance of competent and compassionate care for the well-being of exceptional children and their families. It emphasizes the ethical obligation to do no harm, maximize benefits, and provide effective and culturally sensitive services. Here are some examples on to contextualize this principle. A special education teacher can demonstrate active concern for well-being of exceptional children by individualizing their instructional plans. The teacher assesses each child's strengths and needs and adapts teaching strategies and materials to ensure they receive appropriate education support. Another example, a psychologist conducting an assessment for exceptional child with emotional and behavioral challenges takes precautions to minimize potential harm. The psychologist ensures that the assessment process is conducted in a supportive and non-threatening environment, reducing stress and anxiety for the child. Another example, an occupational therapist working with child and with child with this physical disabilities maximizes or the benefits by providing adaptive equipment and therapeutic exercises. If any harm or discomfort arises during therapy, the therapist promptly adjusts the treatment plan to correct or offset the negative effects. Another example, a speech language pathologist specializing in communication disorders in exceptional children continually updates their knowledge and skills through professional development. They attend workshops and training to stay current with evidence-based practices, ensuring that they deliver competence. Another example, a behavioral analyst working with diverse group of exceptional children and their families recognizes the importance of self-knowledge. The analyst acknowledge their own values and cultural biases and actively seeks to understand, respect the cultural backgrounds and beliefs of the families they serve, ensuring culturally sensitive care. So all in all, Principle 2 highlights the ethical imperative of providing competent and compassionate care for well-being of exceptional children and their families. So it also emphasizes the responsibility of practitioners in the psychology of exceptional children to prioritize the best interests of the child, minimize harm, and continually develop their competence while respecting the unique needs and cultural backgrounds of their clients. Next is principle number 3. So I'll give some examples. No, but let's try to discuss first in this particular principle in the context of psychology of exceptional children. Principle 3 it focuses on the importance of integrity, honesty, and ethical conduct in all professional interactions. It emphasizes the need for transparent and communication, the avoidance of conflicts of interest, and the prevention of harm to individual and communities. Here are practical examples and context. On honest and truthful communication with exceptional children and their families. A clinical psychologist, for example, is conducting therapy sessions with a child who has autism. The psychologist communicates honestly and truthfully with the child's parents about progress of therapy, the strategies used, and any challenges faced. This open communication helps build trust and ensures the child's well-being prioritized. Next, on complete disclosure of information in IEP meetings. So during individualized education program or IEP meetings for exceptional children, educators provide complete and accurate information to parents and caregivers. They openly discuss the child's strengths and challenges, proposed interventions, and expected outcomes. Complete disclosure empowers, of course, the families to make informed decisions about their child's education. Of course, we minimize biases in assessment and intervention. For example, a speech language pathologist conducting an assessment of a child with a speech disorder takes measures to minimize biases. They use culturally and linguistically appropriate assessment tools, considering the child's cultural background to ensure accurate results and equitable care. On preventing exploitation of exceptional children, a behavioral analyst working with children with intellectual disabilities ensures that their interventions are solely for benefit of the child's development. The analyst does not exploit the child's condition for personal or financial gain and maintains the child's best interest as the primary focus. Next, the declaration of focus or the declaration of conflicts of interest. So an educational psychologist, for example, is asked to evaluate a child for special education services. The psychologist discloses any potential conflicts of interest, such as personal relationship with the child's teacher, to ensure transparency and impartiality in the assessment process. So Principle 3 emphasizes the integrity, which likely plays a vital role in maintaining public trust and advancing scientific knowledge in the field of psychology of exceptional children. So practitioners in the field must uphold ethical standards by engaging in honest and truthful communication, avoiding conflicts of interest, and ensuring that their actions prioritize the well-being of exceptional children and their families. This principle serves as a cornerstone for ethical practice and responsible conduct of psychology of exceptional children. Next is principle 4. So principle 4, in the context of psychology of exceptional children and societal responsibilities of practitioners in contributing to the knowledge about human behavior and using that knowledge to enhance the well-being of individuals, families, and communities. It emphasizes the importance of conducting ethical and culturally appropriate practices. Here are some practical examples and context. Contributing to knowledge about exceptional children. Researchers in the field of psychology of exceptional children conduct studies to increase the understanding of various exceptionalities, their causes, effective interventions as well. So their research findings contribute to the scientific knowledge that informs evidence-based practices, ultimately benefiting exceptional children and their families. So school psychologists working on exceptional children use expertise to develop and implement IEP or individualized educational plans. So they use psychological assessments to identify specific needs of each child and tailor interventions to promote their educational and social development. So improving, of course, the well-being of exceptional children within a school environment. We also promote ethical practices. So psychologists and educators in special education settings uphold the highest ethical standards in their interactions with exceptional children and their families. They prioritize informed consent, confidentiality, and respect for autonomy in decision making, ensuring that the rights and well-being of exceptional children are protected. Universities and training programs that prepare professionals in the psychology of exceptional children emphasize ethical training and supervision. So they ensure that future practitioners are well equipped with knowledge and skills needed to navigate complex ethical dilemmas while serving the best interests of exceptional children. We also develop ethical awareness and sensitivity. So professional organizations in the field of psychology of exceptional children offer ongoing ethics training and resources to their members. These resources help practitioners develop ethical awareness and sensitivity, enabling them to continually assess and improve their ethical conduct and their exceptional and their work with exceptional children. So overall, Principle 4 underscores the responsibilities of psychology practitioners in contributing to the well-being of exceptional children and society at large. It emphasizes the ethical use of psychological knowledge, conducting research that benefits exceptional children, and promoting ethical standards in practice and education. Practitioners in the psychology of exceptional children uphold these principles to enhance the quality of life and opportunities for exceptional children and their families.